Well, according to a report in the Times newspaper this morning, Boris Johnson is planning a public health drive to encourage people to watch their weight. This comes after official NHS figures showed that 1 in 4 patients who died from COVID-19 had diabetes, a condition which can be caused by obesity. Well, joining me now is the director of Obesity UK, Sarah Le Brocq. Thank you very much indeed for being with us, Sarah. And just to clear this up, we know you're a campaigner on obesity. Are you in any way a doctor or a nutritionist or anything like that?
No, I'm someone with lived experience. So I'm living with obesity myself. So I've kind of got the lived experience, but also my background is in science. So I have a kind of science background to back that up as well.
Right, thanks for that. And how do you feel about this suggestion, the Prime Minister talking about himself after his own experiences, apparently saying that he needs to rethink government policy on obesity?
Yeah, I mean, we absolutely welcome this because it's something that we've been asking for such a long time. We've been kind of, trying to get the government to pay more attention to people living with obesity and the services and support that they offer, because currently it's been quite dismal and very much a postcode lottery across the country. So I think this is a really positive step, and I'd like to see the government kind of committing to more funding for services for people living with obesity and looking at things other than just diet and exercise, because for years that's been the focus. We've talked about eat less, move more, but we haven't understood the true complexities of obesity. So I really hope that this is an opportunity for the government to actually educate society around why people live with obesity and why there are so many people, 2/3 of the population, in fact, that are living with overweight or obesity. And then we can look at ways of supporting these people to live healthier lives and to put healthier steps in place. So, yeah, very much welcome
Yeah.
the suggestion.
And what are the policies that you think might be helpful? People have talked about a sugar tax, having an attitude towards sugar like tobacco. I mean, what would you like to see?
I mean, yeah. So again, I want to move away from the focus being around food. Obviously, food plays a part. I'm not denying that. But things like sugar taxes, the diet, the sugar tax on the drinks, and it leads to kind of society pointing fingers of blame to people living with obesity. So it's kind of like, I'm having to pay more for things now because of you, because you've chosen to eat too much. And that's not, we're not looking at the actual true complexity of obesity if we just focus on that side of things. So I would like to see more of a kind of campaign to educate the society so people can understand why somebody might live with obesity, because genetics plays such a huge part. And I don't think people understand that. And then I think we need to look at the service provision that we have currently. So tier 3 and 4 are the weight management pathways that are in place in the UK, but they're very sporadic. So tier 3 is weight management, where you would go on to have diet, nutrition, psychological support. And then tier 4 is the kind of bariatric surgical support. Now, there are some therapeutic drugs out there that are coming to market, which currently aren't available to people living with obesity, yet they have some great data showing that they can help people. So I think we need to look at the bigger picture and look at what's out there, what can we put together as a package to support people, because not one size fits all. We very much need to look at this from a holistic, all-rounded approach, really.
I mean, I have to say the first abuse I get from the pinheads on Twitter is about my weight, which seems to be perfectly acceptable that you can call people fat. I mean, are you worried that this focus on obesity might actually lead to an increase in fat shaming and people actually feeling they're entitled to fat shame people?
Yeah, absolutely. I mean, you talked about the Times article, at the beginning of the interview, and actually, when I read that article, I just shook my head, because the stigmatizing language throughout that article just highlights how much work needs to be done, within the media with reporting and also on society. To think that it's okay to talk about the battle of the bulge and using combative language around this as if it's some sort of war that we're against, and all this language is very stigmatizing. And the evidence shows that the weight stigma actually has a negative impact on health outcomes. So therefore, the more stigma that we have, the less health, positive health outcomes you're going to get. So actually, it's kind of like a double-edged sword. So we need to look at changing the way we talk about obesity, changing the way we treat it, and just being a bit kinder to people. So I absolutely think, fat shaming is going to get us nowhere. So we need to really kind of look at this head on and say, like, let's think about how we talk about people in a much more positive way and support them rather than pointing fingers of blame.
Do you think it is fair, though, to say if you are overweight, you are more likely to die of COVID? Just that blank statement.
No, because again, there's so many factors at play. You have a higher risk of, but you're not necessarily going to die. You might have more severe consequences of the condition, and you might end up having to go to ICU, for instance. But it doesn't mean you're going to die. So again, statements like that are very much kind of scaremongering and causing huge amounts of anxiety amongst our members. Because Obesity UK has over 40,000 members, people living with obesity, and they are very much being very scared about these things. And it's making people not want to go and see their healthcare professional. They very much have people living with obesity having this internalized messaging that it's our fault because we've been told it for so long. And actually, that all needs to change, because until people start feeling like there's support out there for them, it's not just their fault, and that we can help them, then things aren't going to move forward in a positive way.
Sarah Le Coq, thank you very much indeed.